Hi there, it's Dr. Kathleen Cannon, and we're back with the vitamin alphabet. Today we're on vitamin B2 or riboflavin. So B2 in its active form is called flavin mononucleotide, FMN for short, or flavin adenine dinucleotide, or FAD for short. Those are a mouthful. I definitely had to practice saying those out loud a few times. So B2 is involved in many different processes in your body, as are all of these vitamins. B2 is especially involved in your cellular energy pathways, things like the citric acid cycle, mitochondrial respiration, ATP synthesis. If any of that sounds familiar from science classes you may have taken a while ago, those are some of the main areas B2 is involved in. But B2, again, is involved in many things, including your skin health and your vision, your metabolism. Deficiencies in B2 are going to impact those pathways that it's involved in. So deficiencies are going to impact, not surprisingly, your energy, and you can feel more tired. You can get tired more easily. You can feel tired, especially more so after exercise, if that's a new thing. It could indicate a B2 deficiency. And none of these symptoms are exclusive to B2. They can be reflective of other deficiencies, of multiple deficiencies, or of other conditions. So none of this is definitive for B2, just as a side note. Deficiencies in B2 can also affect your skin health and can contribute or be factors in skin lesions, in fissures or cracking. For example, at the corners of the lips, that's a pretty common one that we see, or the corners of the mouth, if you want to say. That's a more common one that we see. And then deficiencies in B2 can impact other pathways that utilize B2. Testing for B2. So how do we know if you actually have a good amount of B2 in your body? There is a simple blood test that can be done to test B2. It's not actually that accurate though, for telling us what your body's B2 levels are and your needs are. Better tests are functional tests of biomarkers in the urine, and those actually look at markers in the pathways that utilize B2 and markers that science has identified as being more specific to B2 deficiency. So they give us a much clearer idea of your B2 status. So if those are available to you, if you're concerned with B2 status, that would be probably a better way to test. Food sources of B2 include things like meat, dairy, eggs, and also leafy greens. So it's another good reason to keep eating those leafy greens, especially the dark, deeply pigmented ones. B2 is a water-soluble vitamin, which means that it's best taken with food to help you absorb it. And B2 is actually best taken when it's taken with other B vitamins, if that's appropriate for you, because they all work synergistically together, and it can help your body. It can actually help some of the other forms get activated in your body if you have enough B2. So B2 plays a role there, but they all work really well together, and a lot of them function or are used in the same functional pathways. So taking the B vitamins together is a nice idea, especially with B2, if that's appropriate for you. As a reminder, none of this is recommendations for you. It's all just for informational purposes. So I hope you've learned a little something about B2 in here, and I hope this has served you. May you be well.